Today we're going to do an overview of the programs and also chat about the Foundation's response to the pandemic. Today, my name is Melinda Rhodes, not just today, but always. I'm the Patient Services and Community Events Manager at the Oregon Lion Sight and Hearing Foundation. And I have with me my amazing supervisor, Kerith, who's the Patient Services and Operations Director at the Foundation. And Kerith just had her 10-year anniversary at the Foundation, which is incredible. And we're very, very, very lucky to have her. And today, Kerith's going to be talking about the Patient Services and Mission Cataract history. Also going to be talking about the program overview and how to access the program. And then I'll finish up with a COVID-19 update, talk more about your Foundation's response to this trying time. So I'm going to pass it over to Kerith now, and she's going to chat a little bit more.
Thank you, Melinda. I really appreciate that introduction. So Patient Services history. I love Patient Services. I love the program and what it does. It is the Oregon Lions Sight and Hearing Foundation's first and longest running program. In 1959, our foundation office opened at this location inside the brand new Devers Memorial Eye Clinic building. And that building was actually built with the help of Lions Club members. They helped fundraise with Legacy Good Samaritan to build that building. And in return, Legacy actually gave us, as a foundation, free occupancy in this space. That means that we don't pay rent, we don't pay utilities or basic maintenance, and that's for this amazing office space in Northwest Portland. And so that savings has allowed us over the years to help many, many more individuals than we would have been able to otherwise. And that partnership with the Legacy Hospital and Devers is really our longest running partnership. And it's still strong today, and I expect it to be strong for many, many years to come. And those are just some fun pictures of our logo and the opening of the building all the way back there in 1959. So then I wanted to tell you a little bit about one of my favorite parts of the history that I hear about Patient Services, and that is our co-founder of the foundation, Lion John Anderson, who's a Park Rose Lion. He is so dedicated to the We Serve motto that he took it beyond where people normally take it. He was actually blind in one eye, and he found out back in the 60s that his corneal tissue was still viable. So even though he couldn't see, the tissue in there was still good. And so in the 1960s, he was actually able to, while he was still alive, give the gift of sight to a young man by giving his corneal tissue for a surgery. And I just always thought that was one of the coolest things I've ever heard a lion doing for another person. And then Mission Cataract, which is our part of our Patient Services program. The history there, back in 1993, he's Roseburg Lion, and his name is Dr. John Mark Weston. He actually started a program called Lions Mission Cataract. So he had been going around doing international mission trips, and he wanted to find a way to bring that sense of mission and of help back here to Oregon. He had a vision that every Lions Club in Oregon would have a provider that was able to donate a cataract surgery to their local Lions Club for their community to help them. And he himself, through the Western Eye Center, saw 20 or more patients every year. And then that actually started the program that we have today that we call Mission Cataract, because in 2008, the Beaverton Lions took that inspiration from Dr. Weston, and they invited Dr. Martin Baelish, who worked with the Oregon eye specialist, and they asked him if he would be willing to help with Mission Cataract. And he said yes, of course, because he's just that kind of guy. So he began hosting a Mission Cataract Day in his office. And he had a day where he would open his office just to Lions patients. So he didn't see regular patients on that day. It was just him and his staff and the Lions and their patients that needed help. And I remember at one of those particular events, a woman coming into the waiting room, and she needed to sit down, and she couldn't even see the chair that she was trying to sit on. it was really kind of unbelievable to me. One of the first times that I'd really seen something like that. And she tried to sit down. She couldn't see the chair, so she had to be helped into the chair and then into the office. Well, within a couple of hours, she's gone through her check-in process. She's had her surgery. She's recovered. And she suddenly realizes that, like, she can already, just after that short period of time, she can see the clock. She can see little bits of color. She can see faces a little bit. And she was so excited. And I just remember being so inspired by that. And that generosity of Dr. Baelish and of these other providers that joined our team over the next few years after that to give Mission Cataract gave over 100 surgeries to Oregonians through their efforts and their generosity. And this was a huge blessing for our foundation, because I remember when I first started working here that there was a stack of cases. It was all these people that needed help, just stacks of files, and each one represented a person who was living here and really needed help and didn't have insurance. And we only had so much funding, and so a lot of these cases just kept having to get tabled, and they would wait for, you know, it could be 6 months, it could be a year, it could be longer before they could get care. But with Mission Cataract stepping in, these individuals were able to get the care they needed. And in fact, now we're in this really unique position, because with the Affordable Care Act that came in, all of a sudden, between the fact that the Affordable Care Act would cover insurance for low-income individuals and all these generous doctors, we actually ended up where those case files for cataract surgeries in particular really dwindled. And so now we have all these providers who are willing to give of their time, and we don't have patients to send them, which is a really great situation to be in, except that I know, and our foundation knows, that there are people out there that need the help. They just don't know about us yet. They don't know that we're out there and that we can help them. And so as we go through this presentation and talk about the application process and who qualifies and who doesn't, I'd really like you to be thinking about your local nonprofits, your shelters, your vision providers that you work with or that you go to, and those immigrant resource organizations in your area, and be thinking about how you might be able to help us connect with them and let them know about the services that we have so that we can help them and send them to these amazing providers that we have out here and ready to help. And so what do our programs do? I've told you a little bit about the history. Now I'm going to get into a little bit more specifics about what those programs are going to do, who qualifies for those programs, and how you can apply for those programs. So first of all, what they do. So they do three main things. The first thing they do is the patient services in Mission Cataract partner with the providers throughout Oregon and Northern California. So the foundation has gone out. Sometimes the providers actually come to us, they find out about us and give us a call, and we network with them and talk to them about our programs, and we find out how we can help one another. The other thing that we do with these programs is we work with your Lions Club sight and hearing chairs to support community members. Now, for any of you out there listening who may not be a current Lions Club member, you haven't quite turned in your membership application yet, or you didn't realize that you could be a Lion, I just wanted to let you know what that is. So every club in Oregon and Northern California that we work with has a very special person in their club who agrees to be a sight and hearing chair. That means that they act as a liaison between their community members, their club, our foundation, and local providers to help them with eyeglasses, hearing aids, surgeries, all kinds of program access to things that we have here at the foundation. So they're my favorite people. I love all the Lions, but the sight and hearing chair has a special place in my heart because of all the work that they do and how they connect these programs. The third thing that our programs do is they help individuals in our communities access vision and hearing surgery and treatment. And I've listed here just a few of those things that they're able to access, some of the main cases that we get every year. And one of the things I wanted to mention when it comes to access that people don't always think about with our program is that access isn't just for someone who's uninsured. We actually get a lot of people who, with the Affordable Care Act, are insured. But because of the program, that the particular plan that they have, I actually had one person who applied for cataract surgery because even though they had insurance, they had to pay $3,000 up front before their insurance would start. And that just wasn't something feasible for them to do. We get patients that have Medicaid or other plans where it doesn't cover all of the related costs. And for some individuals that we work with as Lions, their income just isn't in a position where they can afford to pay those copays. Even if we're talking about $250 or $500, to some people that might not seem like a whole lot, but for some people that means no electricity or no food if they're going to pay that copay. So we step in and help in those situations. The other thing that we found is that people who are self-employed often have difficulty finding an insurance plan that, based on what their income is as a self-employed person, they can actually afford to pay out of pocket and still be supporting their family members. So that becomes really complicated for them. So we also step in and we can help those people. And then finally, immigrants. So there's people that are here that have green cards that are citizens, and they can get access sometimes to the Oregon Health Plan. But then there's that group of individuals that are here and they're working and they're providing for our community, or they're living here and giving back, but they don't have access to health insurance because they're not legal citizens here in the United States. So the Oregon Lions Sight and Hearing Foundation and our Lions Clubs, that's just not something that we consider a barrier. So if you're working with people that don't have that legal status, we're still willing to step in and help them with these vision treatments. And I got to tell you, a lot of people that are coming in from these other areas have a lot of vision situations going on that they need help with. So that's another reason to really work with those local immigrant organizations to find out, that, make sure they know about us, that we're out here and that we can help. So then what I wanted to do is kind of give you an example of our programs through looking at different parts of our state. So for those of you that aren't Lions, our state's divided up into multiple districts, 36, and then in 4 different areas. So that's how our Lions look at Oregon. And our multiple district 36E is our Southern Oregon and Northern California area for Lions. And on the slide, I've listed out some of the amazing provider agencies that refer clients to us, or that we send people to, and that we work with on a regular basis. The majority of those residents in E, for whatever reason, we get a lot of retinal related issues. So they have a lot of vitrectomies that they need help with, or Avastin injections is another thing that we do a lot of assisting with in that area. So as an example, we have 2 clients, Maria and Ava. They have macular degeneration that causes their retina to deteriorate. And they receive quarterly injections into the eye, which I gotta admit, like, gives me a little bit of the creepers when I think about that. I can't, it's so amazing to me that people can have that happen. But they get quarterly injections and sometimes laser treatments that help slow down that macular degeneration and help maintain a level of sight for them. So they're not legal citizens. So these 2 ladies, if we weren't able to step in as Lions and with these generous providers that we work with, those ladies are going to be blind. They're not going to be able to see. And they come back to us, a few times a year, and they need that help, and we're here to help them. And that's one of those really exciting things that we've been able to help with in that area. And then when you go to our 36O, which is the Northwest Oregon area, which is Portland, the Tri-Counties, and then all the way out to the coast, one of the interesting things I find in this area, and that I also wanted to use as an example, is this item called autologous serum eye drops. So autologous serum eye drops are an eye drop, and it's made from a person's own blood. So a person gets a blood draw, and then the serum is created from that they can use as drops. And it helps with people that have really severe dry eye conditions for a variety of reasons. And one of the fun partnerships that we've had all these years is being able to work with Lions Vision Gift. And now Vital Tears have actually stepped in, and Lions Vision Gift is not handling that program anymore. They're just switching now over to Vital Tears. So we work with both of these organizations, and they actually provide the blood draws and the drops for individuals. So we've been working with them to help individuals access this treatment. And this is one of those situations where it's not covered by insurance. So even if a person has gone through all the steps they need to with Oregon Health Plan, they are not going to be able to have this covered by their health insurance. And so we step in and help people with those costs so that they can go in. Usually a couple times a year, they have to go in and get a new draw and get these drops. So that's one of the fun things that we get to do in this area. And then the next example I wanted to give you is a pretty cool example, actually, and it's a weird mix of happening here in the Portland area, but it's actually related to District G. So District G is our Eastern and Central Oregon area, and one of the cases that came to us was actually a case of a person that had keratoconus. And here in at the Legacy Devers Memorial Eye Clinic, they actually are able to do a procedure that's brand new, just started in 2016 here in at Devers. It's a corneal crosslinking procedure, and it involves vitamin B2 eye drops that are put into someone's eyes, and then ultraviolet light is used to help strengthen kind of this corneal collagen fibers. I was trying to think of the best way to describe that. And it actually causes new crosslinks to develop in there, and that's where they get the name corneal crosslinking. So in this picture, it's actually Josh Buxton, and he's from Baker City, Oregon. And he, at 26, found out that he had keratoconus, which was something that his father had. And he was looking at having to have potentially a full transplant for his cornea. He was finding that his sight was getting blurry. He was having a lot of trouble with just seeing what was going on. His eyes were really painful and tearing up quite a bit. And he actually ended up having to stop driving because of it. And then he very quickly lost his job, which was doing construction work. Because as you can imagine, if you can't see, you really can't work with construction tools and on those work sites. It's just not a safe thing to do. Well, at the time he was married, he had little girls at home that he was trying to take care of. And so when he looked at the cost and found out how much it was going to be out of pocket for him, he just realized he couldn't afford it. Luckily, the Baker City Lions were able to step in, and they helped Josh connect with us and with our Lions Patient Care Program. And the Baker City Lions even went a step farther and helped him with some of those travel costs, and we helped just make sure that he could get here. But he was able to come out from Baker City in here to Legacy Devers Memorial Eye Clinic, and he was able to go work with Dr. Michael Strako, who works here at Legacy Good Sam, and was the first provider here that was performing this procedure. And he was able to get both of his eyes taken care of. He was able to have the cross-linking done so that he doesn't have to go have a full corneal transplant. Much faster healing. He's back home. He's working again, and he's actually got a new baby boy that he's really enjoying right now. So it's one of those really great success stories where you've got this young person who has a family that he's trying to support. And with the Lions connection and our connection with Legacy Devers, we were able to get this person back to work, back to his family, and back to being a productive, able to take care of his family and just be a productive person. So that's one of my favorite stories about 36G, and this really cool, like brand new procedure that isn't quite covered by insurance yet. Another reason where they need us. The hospital part's covered, some of the other pieces are covered, but not the whole procedure. And so we're able to take that piece that insurance isn't covering yet and really step in and help people. And so then I wanted to get back to Mission Cataract and step back into the Mission Cataract program a little bit. And I'm going to do that by talking about our Multiple District 36R, which is the area that covers Salem and Eugene and all those areas just north and south and all around there. And that is an area where we get, for whatever reason, we get a lot of Mission Cataract requests for that area. And so we have been really lucky in that area because we have a Eugene downtown Lion, Dr. Matthew Neal, who actually happens to be an eye surgeon. And so he has generously donated quality care for individuals in that area that are referred from our Lions clubs and our office to his office. And just like our other Mission Cataract providers, he's a great example of that. He's a generous person. He gives his time. He gives his staff time, he gives office supplies, he donates the use of his facility, all this equipment, and that includes somebody being able to go in before the surgery and get an exam. It includes follow-up care, a week, a month, a few months after. It's really this big picture that they're donating. They're very generous, our Mission Cataract providers, with their care. They also give quality care. They really care about our people. They treat them well. They really want to have an impact on their community members. And so we get really great feedback about how our patients are treated when they go to see these people. And they are dedicated to helping their community. At least every few months, Dr. Neal is seeing one of our patients and providing a surgery for them, sometimes more often than that. And just like our other Mission Cataract providers, I have not yet once called or sent information over saying, I've got this patient in your area, could you help them? I've never had anyone say no. Dr. Neal and his team especially, as soon as I call, they're like, yep, we got it. We're going to take care of them. It's just really great knowing that we can give our clients to this situation and that we've got someone out there that's going to be that generous and that dedicated. It's just a huge help for our organization. So then the next thing that I wanted to talk to you about is who actually qualifies. And so this is people of all ages. So this could be someone who's 2 years old, or it could be 102. This is somebody who's uninsured, they don't have access to insurance, or maybe they do have insurance, but they're just underinsured, and they need a little help, like with those copays that I talked about earlier. They need to live in Oregon or Northern California for about 2 years. They don't have to be a citizen, but they do need to live here. We want them to be a community member of the Lions Clubs that formed our foundation. And the Lions Clubs that formed our foundation in that multiple district area are that Northern California and Oregon area. So that's why they need to be somewhere in that area. And just as a note, even if they're homeless, maybe they moved from Eugene to Portland to Salem, maybe they're traveling around, but they've been physically in Oregon for a couple of years, they're still going to count. They don't have to physically be in one place for that whole time, just within our basic area. And then the tricky part of patient care is that medically necessary procedure portion that I have sitting there. It's a difficult thing to explain, so I don't go into any real detail here except to let you know that that's why those medical notes that we ask for with the application are so important, because we want to see what the doctor is saying about this person's vision and what procedure the doctor is recommending and what the person's vision condition is. Is this something that's urgent? Or is this something that's really not quite ready yet? For those of us who are 50 years of age or older, we're all at some point likely to get a cataract. And if I get a cataract tomorrow, that doesn't necessarily mean it's ready to be operated on. It just means that it's there and my doctor wants to keep an eye on it. So we get applications quite frequently for people who still have 20/20 or 20/30 vision, but their doctor has said that they have a cataract, and they get really nervous and they immediately apply because they want help with it. But it's not quite time yet for them to have their procedure done. So we rely on that medical necessity piece that we look at in those applications to see, is it really time for them to have this procedure? And then lastly, we look at their household income level. So we do ask that people be at 200% or less of the federal poverty level when they apply to our program as a household. And so that's the last kind of qualification piece for the application. The next thing I'm going to show you is how to access the program. It's actually pretty straightforward. We have these next few slides are going to show you our patient services application form. I know sometimes you go to apply for something and you've got this huge application and all these lists and lists of documents that you have to supply. Our patient care program application is actually 4 pages, and one's a cover page and one's a signature page. And then we just want to know some basic information. We want to know about the person who's applying, where they live, who we contact to ask them questions about their application. Do they have any kind of insurance? And then we want to know about their medical provider. We want to know what kind of care they're asking us to help with. We want to know who their current provider is, if they have one, and how to contact them. That's really important. It's surprising how often somebody skips that section and doesn't actually tell us what they want help with. And then finally, we're going to ask about who's in your household. You know, how many kids do you have? Are you taking care of your mom, or are you the mom and you live with your grandkids and they're your sole source of income? So we want to know that information. So that's what this next section is for, very important for our program. And then finally, we're going to have a page where we ask you to give us permission for us to be able to share information with our committee that's going to review your application. And it actually gives us permission to ask questions of the provider that you went to see. And then finally, it has a spot for your local Lions Club to actually review your application and help provide a sponsorship for you here to our foundation office so that we can connect you with our program. So it really is pretty straightforward. That doesn't mean that you're not going to have questions. So please, anytime you have questions, do let me know. Sometimes people want to know just little details of something and they're not quite sure about something. Anytime you have a question, just let me know. There's never a question that's silly or anything like that. There's a lot of details that go into the behind the scenes for this, but it's really important that we make sure that you get all your questions answered so that you can get access to the care. So proof of income, that's probably one of the #1 things that we need to have with this application. And I've got a few things listed on the next slide that will show you various things that we can have as proof of income. So we're going to need those things. We're also going to need medical chart notes, those notes I talked about from your doctor that show us what your current vision status is, what your vision is with glasses, without glasses, what your doctor's recommending you have as a treatment. And then also we're going to want that information about, do you have insurance? If you don't, why not? And then if you do have insurance, what kind of funding do you need our help with? And lastly, there is a spot on the application for a personal note or a story. And sometimes you don't necessarily have to have that piece of it. Not everybody feels comfortable putting that in there, but I'll give you an example of when that becomes really important. One of the things that we help with that not many other organizations do is a prosthetic eye. So for somebody who has had one of their eyes removed, sometimes they'll just get a patch and they can go the rest of their life with just not having that eye there. But there's other situations where people really medically would benefit from having a prosthetic, or they already have a prosthetic. They've had it. We've actually had people come in that have had the same prosthetic for 30 years, not recommended. It really at that point needs replaced and taken care of. We actually had a young man in his late 20s, early 30s who was working and had a prosthetic that would roll as he was talking to people. And he found that really difficult to provide customer service when one of his eyes was moving up and down in his head, and it was really distracting for people. And so we actually stepped in and helped him get that prosthetic. Now, having his story, knowing that he was trying to work, knowing that it was moving, that was really important for us. And he didn't necessarily have doctor's notes because he wasn't going in to have a treatment done. So there wasn't necessarily a note from a doctor saying, this person needs that prosthetic. Sometimes there are, but there aren't always. So that story becomes really important for us to know, oh, you know, that's why this would really impact that person's life in a huge way, and we really want to help with that. So that's why all those pieces are important. And then I want to talk to you a little bit about that referral process. So getting referred to the program, you can do that as an individual that needs the help. A Lions Club can refer someone to our program, a social worker, a caseworker, a medical provider. I've had school counselors refer a child's parent to the program because they know that they need help. Really, anyone can make that referral. And you can do it in a couple of different ways. You can call our general referral line system, which is how people all throughout the state access Lions Club's carers if they're not sure who to directly contact. They can call this referral line, and then we can help them figure out which club they're working with. You can also just reach out to me. That's my email there. You're welcome to send me an email or give me a call here at the foundation office, and I can help connect with the application and answer questions about the process. And for those of you who are in an area where you are a Lion or you know who your local Lions Club is, you're more than welcome to just reach right out to your local Lions Club member and ask them for help, because a lot of those local Lions know about our program, they've got the application forms, and they're ready to help you connect with us and get the help that you need. And then the next thing that I wanted to do was give a little shout out to our patient care committee. So this patient care committee, they're the ones that actually do the application review. So those all come in to me, and I do a basic review and look at them and check to see if the pieces are there. But then I have this amazing group of people who are made up of individuals from around our multiple districts. So we have a Lion from each of the areas that participates in our committee, and we meet on the second Wednesday of each month to go through all the cases that have come in that are ready for review. We have an annual budget that we work with that we split over 12 different months, so that we don't spend all of our money in July 1st and then not have anything left over for when we get to the end of the year. We want to try to make that stretch throughout the whole year. We do give priority to urgent surgical cases. So if we have somebody who is asking us to help with a medical bill for something that's already happened, and then we have another person who's got an urgent situation that needs to go to the provider, we're going to prioritize that one first. And then we also have a note here about how, for those of you that were wondering how the two programs relate to one another, if you haven't kind of seen that a little bit already, our cataract cases that come through our patient care process are generally referred over to our Mission Cataract program, which just means that we take this application for patient services, which happens to be a cataract surgery, and we connect it with someone who's generously agreed to help through Lions Mission Cataract. And we connect the patient with that program. So we get that service donated, which frees up more dollars for our other cases, like retinal care and other things like that. And so then I wanted to tell you a little bit about who's on that committee and just give them a thank you for all the work that they do. So I've got Phyllis Carlin, who is from Crooked River Ranch Lions Club, and she is an amazing person out from District G, brings her passion for community members and service to our committee. We've got East Albany Lion Robert Springer, who is a retired optician, and really important to have that kind of background on the committee. We have Portland Oaks Bottom Lion Mary Lee Turner, and she brings a really unique perspective because she lives with low vision. She has almost no vision herself, so she is able to show us and empathize and give us a description of what somebody is experiencing based on what their vision condition is that they're turning in, which really gives us a unique way of looking at a case. And so that's really important to us. One of our newest members is Portland Legacy Lion, Dr. James Sanchez, and he actually works with Dr. Mark Terry, who many of you may know, and with Dr. Michael Straka, who I referred to earlier, here in our Legacy Devers building, and then he volunteers his time to come in and help us every month with case review and answer questions for us. And then our current committee chair is the amazing Milwaukee Lion, Helen McNaughton, and she tries to keep us on task and helps track all of our meeting notes for us. And then finally, I've got these two gentlemen. So the man that's smiling with the lion on his shoulder is Dr. Steve Tronis, and he is a retired provider from the Western Eye Center. And he actually was the chair of our committee for many years and really brought that medical piece to us and was a really great guide for our committee for many years. And then the other picture here is Dr. Richard Chenoweth, and he is with the Ashland Lions Club, and he is a retired retinal surgeon. And he has actually trained a lot of other retinal surgeons over the years. And when we're talking with providers, a lot of them actually, oh yeah, Richard, we know him. So he's a really great guy to have on part of our team. And in this picture, he's actually seen here with Angela Dillard. So at 2 years old, she was actually diagnosed with retinoblastoma. And her mom was a struggling single mom. She was trying to make ends meet. And the Lions and the foundation office came together and they helped Angela get surgery that she needed. She actually ended up having over 25 surgeries for this little person, having to go through all that in her life, which I just can't even imagine how the mom and the daughter went through all that. But luckily, the Lions were there to help and step in and help fund that situation. She actually was a poster child for the Lions Foundation in 1979, and her mom actually went to a lot of conventions at that time to share the story. And Angela actually lives in Salem now. Our executive director actually reconnected with her, and they came to our Salem Keep the Promise breakfast last year, and she actually is supporting our organization, which is fantastic. And she actually said that the Oregon Lion Sight and Hearing Foundation has been a part of her life since before she could even remember, and they were there when her mom and she needed them the most and gave her the gift of sight. And that's such a powerful statement and so amazing to actually meet someone and talk with someone who all those years ago got that kind of help and now years later is still, you know, remembers the Lions and cares about what we do and wants to give back, which is pretty amazing. So Dr. Chenoweth is actually making this his last year on our patient care committee after many, many years of dedicated service and all this knowledge that he brings to us. And I'm going to miss him very much, and I think he's amazing. And I really wanted to give this chance to just thank him for all of that he has given us. And it's just been really amazing. And it's going to be sad to see him go. And it was hard to see Dr. Tronis go. And it's such a great team. And everyone stays together for so many years to help with this. So thank you, Dr. Chenoweth, for all that you've done. And then let's see. I am going to tell you a little bit about that final step in the process for your case. Your application's got turned in, it's been reviewed by these amazing people, it's got funding now, and so what happens? And so once that's all wrapped up, I actually reach out to the providers. We try to keep you with the patient with the provider that they were working with when they came in. That's not always possible because not all the providers will work with us on those discounted rates and donations, but as much as possible, we do try to keep you local. And what happens is that I actually reach out to them after we've approved the case, and I find out, like, as the funding amounts, have we got the right things? Are we all lined up? Do you want the patient to call you, or do you want to call the patient? How do you want to handle that part of the process? And then I find out how they want to get the approval documents. What official things do they need from me to be able to take those next steps with the patient? And I get all of that set up and all of that prepared. And then I'll actually reach out to the patient, the caseworker, if there's a caseworker involved, and I'll also notify the local Lions Club who is working with them to let them know that their community member is getting help and who they're going to be working with. And then finally, that patient is going to make that connection. They're going to go in, they're going to get amazing service. Their vision is going to be taken care of, or their hearing in some cases. And then those invoices that the providers have, all the costs related to that surgery, are going to get sent here to the foundation office. So the patient doesn't have to worry about the money side of it. We're going to get that taken care of for them. And so they don't end up with a big pile of debt because of their medical need. So that's one of the cool things that we do after. And so here I am the cat lady, I have to admit. And so every presentation I do has to have at least one cat photo in it. So here it is. And it's with my just notes to kind of just follow up and really push home. And that's for the timeline for the process. So every now and then we get somebody who calls and says, hey, I've got surgery on Friday. So how can you help me with that? And I'm like, oh gosh, I really wish we could. I'm so sorry. And sometimes there's not much we can do to change that, and they'll just send their bills in afterwards. But most of the time, it does take a few months to go through the entire process. And the reason for that is you do have to fill in that application. So part of the timeline is just getting the application turned in by the person. And then sometimes they send it in and it's missing pages, or it's not, doesn't have all those pieces with them, or there's a piece missing and there's no explanation for why there's no proof of income. And so those things are all really important. So pay attention to those missing pieces when you turn your application in. And then also follow-up questions. Sometimes we'll get the case and I've looked and all the pieces are there, but when our team reviews it, they'll notice something medically that I didn't notice. So they'll have questions or something else that we need to look into before we can move forward. Or there's a funding question that needs follow-up on because we're not really sure about that piece of it. So that can add a little bit of time to it as well. And then even once you're approved, if we've got everything ready, we've got all the information to the provider, then the other good thing to keep in mind is that it does take a few weeks for the provider to be able to get you into their schedule, have your patient come in, and then be able to do the surgery. And so all of that takes a few steps. And then sadly, sometimes it is a funding issue. So we'll review your case and we really want to help you. You qualify in absolutely every way, but we don't have enough dollars that month to move forward with your case. And so we'll end up what we call tabling, and your case gets moved to the next month, where hopefully that month we'll have more funding that's available that we can actually step in and help with that case. So there's a variety of reasons in there for the timeline. Sometimes it goes much faster than that, but we do try to make everyone aware that it's not going to be something that you're going to turn it in and it's going to be done that week. It generally is going to take a few months. So that's just things to keep in mind and noting that. And then finally, you guys don't have to listen to me talking anymore. I'm actually going to hand this back over to the amazing Melinda Rhodes, because I wanted to have her tell you about this really cool way that one of our other programs, community screening, actually connects with our patient services program and how you can get involved there. So Melinda, I'll give it back to you. Take it away.
Thanks, Kerith. And so we are actually the Oregon Lions Sight and Hearing Foundation is a part of the Oregon Vision Coalition. And you can see some of the partners listed below. You may recognize some of them. They do incredible work in their communities, and we're very fortunate to be a part of this coalition. And through this group, we actually have partnered with Lions Clubs. I wanted to talk specifically about an event we did last year at the Rockaway Lions Clubhouse. You'll see that great picture there on the left is Lion Lulu Bowman. Don't let her small statue fool you, because she is a very big personality and she gets a lot of stuff done, and she was the main organizer for this event. So we did work with KCI Institute's mobile eye van, as well as Pacific University School of Optometry. And I believe that Lisette is on the phone right now, and she's one of the coordinators for Pacific University's mobile clinic, and we love working with you, Lizette, and Dr. Borbage. So we went out last year, and we were actually able to see 85 people, and there was a couple of urgent follow-ups that were required. One of the women we saw actually had macular degeneration was detected. So we were able to connect her with their insurance, and within days she was in Portland being seen, and then now is receiving ongoing treatment. So without that clinic, she wouldn't have been detected, which is exactly why we all come together as partners to do that. In that photo in the middle there is a woman by the name of Christine, and she's really captured all of our hearts. She's a really incredible human. And when she came into the clinic, she could not even see the steps that she was taking. She was aided by her friend, and she went through all of the stations, was seen by one of the optometrists that were there, a volunteer optometrist, and found that she was nearly blind from cataracts. And I don't want to get Kerith going because it's very emotional when we think about it, but after she found out that she was going to be able to regain her sight, again, it was quite emotional for her and for all of us to witness that, because if you can imagine thinking that you're going blind and then have somebody tell you that you are going to be able to see again, it's a truly incredible moment. And I feel really fortunate to have been a part of that. She said that she couldn't see her little dog anymore, and she actually lives 2 blocks away from the ocean in Rockaway Beach and hadn't seen the ocean in years. So with the help of the Lions, Lulu, and Terry's the gentleman on the right in that photo, they actually transported Christine back and forth from Rockaway to Portland so she could do all of her pre-op and surgeries and post-op appointments, and now has regained her sight. And that's thanks to our community partners and also through the patient care program. So we really appreciate that connection, and you can kind of see how that sort of comes together as a full circle. I also wanted to talk a little bit about how the Oregon Lions Sight and Hearing Foundation is responding to the COVID-19 pandemic. I know that everything's been sort of flipped around and it's affected everyone and everything. One of the things that the pandemic has affected is right now would be one of our big fundraising seasons. So we usually do our Keep the Promise campaigns. We do breakfasts all throughout the state. So unfortunately, we weren't able to do that in person. So we've been reimagining that and having virtual fundraisers. So many of you may have already heard from us. We've reached out to ask if you'd still support us during this time, because we need your support more than ever right now. And so we appreciate all of you who have been able to continue to support us. The next picture, I love that photo. It's kind of a Brady Bunch-esque photo where we're all doing a virtual meeting, and we've actually been all working remotely since March 16th. And we actually had some of our field staff there as well. So it's really great to connect and see each other's faces, because it can be a little isolating to not see everyone. But we are very, very fortunate. We still have our jobs. We still have a lot of work to do, and we get to work for this great organization. The next photo is a bittersweet one for me, as we've found that Sammy, one of our opticians, has actually moved on to another opportunity. We wish her all the best luck, because we were very fortunate to have her with us for the last couple of years. And she was still going into the office several days a week to help folks get glasses through I Promise. So we appreciated all she was doing, and now we've got the other optical team that's going to step up and take that place. So down below that is a photo of optician Tracy Brown's son, who's also a fellow Portland Legacy Lions Club member. And they were sorting donated hearing aids at the Lurk, which is our Lions Eyeglass Recycling Center. And Tracy's been going out there quite a bit to help sort things, and literally sort things, and then also sort things that have been going on at the Lurk. So we appreciate her. And the middle bottom photo, you can see we're still sending eyeglasses off to providers, and as the providers start to see folks, you know, we're going to be working with the Lions clubs and the providers to ensure that they're able to do that safely. We're not going to inundate them with Lions clients, but we're going to also help make sure that they're able to see our Lions clients who've been pending, because these folks really need assistance. And then the bottom left, I put that on there because of Kerith. That's actually a picture of Kerith's kitty cats that are helping her work remotely, and we've all really appreciated when we're having a chat and we're doing a virtual meeting and we get to see kitties kind of pass by the camera. So she is a bit of a cat lady. I think a lot of us are at the foundation, so we all really appreciate it, and we all say hi as they pass by. But I also wanted to talk about some of the things that maybe you might want to consider doing at this time, and I'm sure you may have gone through all of the Netflix movies you could possibly watch, and you've learned how to make sourdough bread, and now you're wondering what's next. So something that you might consider is organizing your files. Maybe you've got some, you know, if you're a Lions Club member, you've got maybe clients that paperwork from clients from years and years ago, and maybe you don't need somebody that you helped in 2007. Maybe you can shred that paperwork now, or you can also be putting things in electronically. You can update your systems. We've actually all as a team sort of talked about the silver lining to the pandemic, which is we have a lot of work that we're doing, you know. We work in a nonprofit, you wear a lot of different hats, you know, figuratively and, well, literally for me. You know, and so we've been trying to figure out a way that we can sort of do those things we've been wanting to do and update some of the systems, and that might be a great time for you as well. And if you're interested in finding some new and innovative ways to maybe, you know, track some of the clients that you're helping, and you know, reach out to us, we'd love to help with that. You can also learn more about our programs. We actually have our the past 2 webinars we've done. We did one on Lions Eyeglass Assistance Program and also our Roar Hearing Assistance Program. We have those listed on our website, so you're able to connect to those. Follow up with applicants. That's really important because, you know, you've been sort of kind of feeling like you're floating, and applicants feel the same way. They don't know, you know, are you still going to help them? Is the club going to still help them? You know, and it's really important to reach out and say, we see you, we know you exist, you know, we know you need help, and or to find out, do you still need help, and find out ways that you can sort of let them know that they are still in a queue to receive assistance. And another aspect is community partner appreciation, and we've all been doing a lot of this, reaching out to all of our partners that Kerith has been giving great praise to throughout her webinar today, but we couldn't do what we do without them. And sometimes it's easy to take that for granted, and now's the time to pick up your pen and write an old-fashioned note, you know, and send it to them, so that when they get their mail, they see that and they feel appreciated. Or it could be in the form of an email or a phone call, something that just lets them know that you appreciate them. You could be obtaining testimonies, which means, you know, if you're a Lions Club member and your club has helped somebody, you can get a quote like Kerith had shared about Angie Dillard, you know, just something that kind of brings that back, you know, so that you're able to share it with your community, and more people will want to join the Lions Club, because the Lions are great. If you're not a Lions Club member out there, you know, we'll get you eventually. You know, and also the foundation, we can really use that, because that's what we use to tug at our donors' heartstrings, and to send off to, you know, for grants, things like that. So our amazing development director can use those quotes and those stories to help us gain more funding. You can schedule a presentation with one of us here at the foundation. We'd love to come out to your club and do a presentation. And if we can't do it in person, you know what? We are really good at doing virtual presentations and virtual meetings now. So I think we can make that work, and it'd be fun to try to do that. And also connect with community agencies. You know, just where I'm sitting right now in Northeast Portland, I can think of 3 or 4 wonderful community agencies that are doing great work in my community. You know, just down the way is Habitat for Humanity. There's a Head Start just a couple blocks away. Really great organizations that I might want to volunteer with, you know, and maybe there's something I can do from home that would really help them at this time, or even just helping fundraise for them. So a lot of things you could be doing. And I wanted to kind of open it up for questions now. I think I saw a few questions come in, but I'm going to turn it over to the amazing Brenda Anderson. Brenda, would you be able to help share some of those questions?
Happy to. Thank you so much. One of the first questions that we received from Susan was, Susan is hoping that Kerith might address what now I'm going to be terrible at the pronunciation, a treblectomy?
So that is actually one. We don't get requests for that very often. It's actually an interesting one. And I'm not able to very quick to Google to like double check myself, but a trabeculectomy is actually a surgery for glaucoma. And it's, I believe it's the one where they go in and they actually remove some of the fluid that's building up and causing the glaucoma situation. So it's a way of relieving that situation.
Excellent, thank you. And you pronounced it much better than I did. I appreciate that.
We think, I'm not sure.
The next question that we have is from Lisette. Lisette is wondering if the patient care application has to be submitted by the local Lions Club, or can it be submitted directly by the patient or another organization, such as Northwest Family Services?
That is a great question, and especially for Lisette, who's a great example of someone who is a Lion and works for an agency and has all these other really cool connections that she knows. So it doesn't have to come from a Lions Club. In fact, a lot of times we actually do get them directly just from individuals. They'll send them in to us and they're not sure how to connect with their local Lions Club. And I do work with a lot of social service agencies like Central City Concern or other shelters. They have a high volume of clients that are in need, and so they'll send the applications directly to me. And then what I do is I actually take that information and I share it with the Lions Club that's in that area and ask them to have a look at the application and just let them know that, hey, there's a person right in your area that needs help and they're working with this agency, and I just wanted to let you know about it, and I just connect with them about that. So I help make that Lions Club connection piece, but it's not always easy to make that connection. Some of the communities, the Lions Clubs are really recognizable and in a physical location where you can get to them. And in other areas, the Lions Club members don't really have as much of a physical site that they're at on a regular basis, or you may just not have worked with your local Lions Club before. So in those cases, I always let people know, just go ahead and send that application to me. I'll help make that connection for you, and then we'll get that taken care of. And I actually love, just so for those of you out there that might be from an agency, I love working with the agencies because I can share more with you about what we're doing and about what the Lions Clubs do, what our foundation does, and how we can help work with you in multiple different ways. And then I can make that connection for you. We love our Lions Clubs. I'm a Lion. We really want the Lions Clubs to sponsor the applications, but a lot of times it is easier for the agencies or the individuals to go ahead and just send that directly into me.
And our next question is from Kent. Kent asks, what hearing surgeries do we facilitate, and is there a separate application for hearing surgeries?
That's a great question too. So, you want to talk about butchering a procedure name? I think it's called meringue. I'm not even going to try. So there are some hearing surgeries. We've actually, well, a lot of you as kids, you know, remember getting the tubes in the ears. We have had a couple of requests that involve that. We've had adults that have something going on with their ear where they need specific surgeries to restore the hearing, or maybe there's some kind of shaping issue that they need to have done so that a hearing aid will work. And then there's a variety of those things that kind of involve the inner ear or making everything work in there. And I know that doesn't sound very technical. That's because we don't get those requests very often. I've actually only seen 2 in the 10 years that I've been here. And so I don't have a real specific one. The other thing we do get is once in a while something related to a cochlear implant. We can't always help with the whole implant is really, really expensive and would take all of our budget to help one person. But sometimes somebody needs help with a specific part or a repair, or there's an aspect of that or a related system that we can help with. So that's actually a great question, Kent. I'm glad you asked that because I didn't even put that earlier in the presentation, but that's also something that we can help with. And it's not a separate application, it's the same application. So whether you're applying for help with a medical exam, a vision surgery, a hearing surgery, a prosthetic eye, all of those things are all included on the one application form.
Thank you so much. Nick asks, what translation or interpretation services are available for patients?
Oh, that's a great question. That is something that we really have been trying to look into a lot through these last few years. Right now, our application forms are available in Spanish and English, just those two languages right now. And so those are available and ready to share right away. We also have letters that kind of explain the process that can be done in English and Spanish. When it comes to other languages, we don't have our applications translated into that. And we are currently, as an organization, in a position where we do ask the individual to find someone in their family or an agency that they work with that can help with that translation piece, and so that they can make that connection for them. Some of the providers we work with, in fact, most of the providers we work with have staff members that speak a certain language, but they, even in those cases, it's really good if the person has someone that they've found that can go with them and work with them on that process. That's actually one of the bigger barriers, I feel like, to care and to accessing our program, is those language barriers, and trying to figure that out is a big part of what Melinda and I have really been interested in, and what our foundation itself has been trying to find different resources and ideas for in the last year or two. So if any of you have any of those ideas out there, email me and let me know, because that's a big thing for us.
One of our last questions is from Brad. Brad's wondering, is there an upper or lower age limit for patients to be served? Because so many of issues do affect elderly.
There is absolutely no limit on the age. It could be someone who's newborn, as far as we're concerned, to if somebody manages to live to 130 or beyond, we don't put any limit on the age. It really is about what kind of care they need, and will that care impact their vision or their hearing and their day-to-day life. That's what we care about. Our focus is really on how can we serve a person, how can we help them and make an impact for them. So if we can make an impact, we will do what we can to make that happen.
Are there any more questions?
That is the end of our questions.
Okay. I was just going to say that if you do think of any more questions and you think of a procedure that I can't pronounce that Kerith can, and you have questions about it, go ahead and email Kerith, and she'd be happy to help. I wanted to end with this wonderful quote. It is pretty, I think, prolific at this time. It says, "I am only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something that I can do." It's a great quote by Helen Keller, who you know is one of our models of what we do and the reason why we do. So we really appreciate all of you and everything you're doing out there in your communities right now. And we want you to be safe, and we worry about you, and we think about you, and we're so glad that you could join us today for this webinar. We hope you learned something. And like I said, if you have any additional questions, please don't hesitate to reach out to us. We would love to hear from you. So thanks so much for having us.
Thank you.